Hi, my name is Kortney Bishop. I'm a Level 2 McMaster Nursing student. Today I'm going to be demonstrating the administration of an IM and a subcutaneous injection. So we're going to start with our patient. I will be giving a heparin injection and a Haldol injection. So before I begin, I'm going to go over my 8 rights, and then I'm going to check the MAR to make sure that I'm giving the right medication and I'm going to be giving the right dose. So I'm going to double check that I have the right patient, the right time, the right frequency. I'm going to tell the patient that they have the right to refuse the medication if they don't want it. And I'm going to make sure that I have the right site. I'm going to ask the patient to clarify what hospital they're in to get a level of consciousness. In the MAR, it shows that the patient is allergic to codeine, so I will double check with the patient, and then I will double check with the medication so that I'm not getting the wrong thing. I will start by observing the patient's body build so then I can choose the appropriate needle gauge and needle length for their build. Assessing the patient, they have a normal amount of adipose tissue and a normal amount of muscle. So to continue, I'm going to use a 25 gauge needle for the subcutaneous, and then I will use a 20 gauge for the intramuscular. The appropriate syringe type that I'm going to be using for the subcutaneous injection is going to be a 2.5 ml syringe, since I'll be giving 1 ml of medication. The appropriate syringe for the intramuscular injection, I'm going to be using a 1 ml syringe because I'm going to be giving 0.5 mLs of medication. Okay, so before I start the subcutaneous injection, the needle that I will be using is already put together, but in a case in a hospital when it's not put together, the needle and the syringe are separate and you simply just screw them together. I've checked my MAR, and I will be administering 1 ml of heparin. And so this is a brand new vial, and that's so you just pop the top off. If it was not a new vial, then I would use an alcohol swab to clean off the top. Okay, so now I'm going to go ahead and I'm going to draw up the heparin. So I'm going to remove the needle, take off the plastic safety, and then I will draw a little bit past the 1 ml line, just so then if I do have air bubbles, I'll be able to get them out. Okay. And then now I will put the safety sheath back on. And then you would apply a medication label to the syringe. So it would include the drug medication, which is heparin. It would label the concentration, so it's 5,000 units per 1 ml, and then the route in which you're going to give it. So it would be subcutaneous. And then this is a label that you would then put onto the syringe to cover, so that if it gets set down, then we know what is in the vial. So then now that I'm done drawing up my medication, I'm going to throw out the top of the vial, and I'm going to throw out the syringe wrapper, and then I will put the heparin back into the proper storage facility. So now I will begin to assemble the medication for the IM injection. Once again, I am using a 20 gauge needle, and it is a 1 ml syringe. So this one is already put together, but if it wasn't, you would just screw the needle part onto the syringe. So I've checked my MAR. The medication that I will be administering is Haldol. It is 4 milligrams per 2 ml, and I will be giving 0.5 ml. We'll remove the syringe from the plastic. This is a new vial of Haldol, so I will take off the top. If it was not brand new, then I would sterilize the top with an alcohol swab before inserting my needle. And I will draw up to a little bit past the 0.5 ml line, just in case I have air bubbles, so then I can remove them. Okay, and then I will put on the plastic sheath. And then I will write out the proper medication label. So I'm giving Haldol. The concentration is 4 milligrams per 2 ml, and it will be given intramuscularly. So then I will attach that to the syringe. Now that I'm done, I will throw away the lid to the vial. I will get rid of the plastic that the needle and syringe came in, and then I will put the Haldol back in the proper storage facility. Okay, so now that I'm ready to give the intramuscular injection, I'm going to come into the patient's room and I'm going to make sure that I have the correct patient using 2 patient identifiers. I will look on their wristband, make sure that I have the right patient, and then I will ask the patient their birthday to make sure that I have the right patient. I will continue. I'll ask the patient if they have any allergies. I do know that this specific patient does have an allergy to codeine. I will explain to the patient what medication I'm going to be given, which is going to be the Haldol, and then I'm going to explain to the patient what the procedure is going to entail. This specific drug, I'm going to be giving the injection in the ventrogluteal muscle. I will be using a Z-score spread. So just the way I spread my fingers, it's going to be moving the muscles, and then I will be giving the injection on a 90-degree angle. So I will perform hand hygiene and put on gloves. It's not a sterile procedure, but it should be aseptic, so I will be using clean gloves. Next, I will landmark where I will be doing the injection. So with my left hand, I will put it, the heel of my hand on the greater trochanter of the hip. My thumb will point towards the patient's groin. My index finger will be on the anterior superior iliac spine, and then the rest of my 3 fingers will go to the iliac crest surrounding the buttocks. So then I know that this is a general area to where I will be giving the injection. I can put an alcohol swab in place to cover the area, so then when I move my hand away to grab the injection, I still know where I will be going. Next, I will prep the area with an alcohol swab, starting in the middle and working out, cleaning for about 3 to 5 seconds. I will grab the medication. I will double check that I have the right medication with the label. So I will be giving Haldol. It is 4 milligrams per 2 mLs. I have drawn up 0.5 mLs, and it is going to be the intramuscular injection. So I will explain to the patient that this shouldn't cause any pain, but it should be like a sharp poke, and that if they feel any increased pain, to let me know. So I will remove the plastic, place my hand, and then I'm going to be going in at a 90-degree angle. I will slightly draw back to ensure that there is no blood, so that I haven't hit a blood vessel, and then I will continue with the injection. I'll put the cap back on, and then provide the client with a piece of gauze to put over to apply pressure in case there is slightly bleeding. Before I gave the injection, when I drew out, if there was blood that was present, then I would start all over with new equipment and new medication, and then go forward with giving the injection. So there is no bleeding, so then the patient is okay, and then I will return to check up on the patient within 15 to 30 minutes to make sure that the medication is working. Now I will take off my gloves. I will throw all my equipment into the disposable, and then I will dispose of the needle in the sharps container. Next, I will be giving a subcutaneous injection of heparin. I will come into the patient's bedroom, and I will explain to the patient what the procedure is going to entail. I will identify the patient using 2 patient identifiers. So I will look at their wristband and I will clarify that the wristband name is the same as the patient's name, and then I will ask them their birthday. I will double check with them if they have any allergies. I know from the MAR that the patient does have a codeine allergy. I will explain to them that what medication I will be giving and that I will be giving it in the abdomen. So for landmarking, I'm going to put my gloves on first. And then the ejection, you want to give it above the iliac crest and then below the umbilicus about 2 inches, and then either to the left or the right. So for this injection, I will be giving it to the right. So I will clean the area off with an alcohol swab. Starting in the middle, working my way out for about 3 to 5 seconds. And then once I'm ready, I will grab my medication. I will ensure that it is the right medication. From the medication label, it is heparin, 5,000 units per 1 ml, and I will be given 1 ml. For a subcutaneous injection, you slightly pinch the skin and go in at a 45-degree angle. So I will take the cover off of the needle. I will slightly pinch the skin, bevel up, inject at a 45-degree angle, remove the needle, put the plastic cap back on, and then apply pressure to the area to ensure that there's no bleeding. Once I'm done all that, I can remove this, and then I will come back to check up on the patient 15 to 30 minutes to ensure that the medication is working. I will throw my gloves and material in the garbage, and I will place the syringe in the sharps container. I will continue to go and document the intramuscular injection and the subcutaneous injection into the computer under the patient's file.